Okay, well, welcome back. And we are here with Dr. Krishan again for another episode, talking all things healthcare, well-being, and wellness. I want to dive into annual health checks. We in our Aboriginal communities know them as being 715 checks. Talk me through that, Krishan, because we've had some conversations, and throughout this podcast series, we'll talk about some specific conditions. COVID, we'll talk about some medicines, antivirals, vaccines, sexual health, rheumatic heart disease, all of these type of conditions that we see in our communities. But I want to talk about the importance of keeping your finger on the pulse, so to speak, about your health and well-being. So let's talk about what is a 715 check.
Hi, Dixie. Thanks for the opportunity to talk about health checks. Now, I think we discussed previously, the reasons that you'd go to a doctor or a health worker, and it may be because you're sick at the moment and you want a diagnosis and you want treatment. But really, equally importantly, and some people say maybe more importantly, even is that you go when you're actually not sick, and so that's what we call preventive health. And these are the times when you go to your health worker for a general checkup. And that's where these health checks that you're talking about come in. So let's start maybe with the first thing I was talking about. That's when you have a problem, you want to get it checked out. It's really important you go to a doctor, a health worker, before things get too bad, whether it's a sore throat, whether it's something else. So you don't put up with it, and you go and see a doctor as quickly as possible. However, then there are those times when there isn't actually anything wrong with you, but we know now from research that if we want to talk about long term, so over the course of your entire life, the best way that you can look after your health is not to just go to your doctor when you're sick, but it's actually to have that longer term relationship with your health worker so that they know everything that's going on with your body and with your life as well. And so that they can actually prevent conditions from coming on, and whether that's diabetes, whether that's kidney disease, whether that's heart disease. And so, there are things like stopping smoking. There are things like, checking your blood pressure, checking your urine to see whether there are any early signs that you may be getting one of those longer term, chronic illnesses. And that's what one of these health checks are really all about. They're quite detailed. They take a long time, so you need to book them in. So your health worker will be expecting to spend up to an hour with you, so they can really go into in depth to your health. And they'll probably ask you a whole lot of questions about all of your symptoms, about all of your different body parts or different symptoms. Whether it's your breathing, whether it's your heart, whether it's your kidneys, whether it's your liver, whether it's your bowels, and your arms and legs as well, how your memory is, whether you're getting headaches. So they're not being nosy. They really just want to see whether there's anything going on that they might be able to catch early and prevent from getting any worse.
So this isn't really about if you wake up and you feel crook, you got a tummy ache, you got a headache, you got a pain in your arm. It's not about being reactive to those symptoms that might be sitting in front of you. It's about preventative healthcare, and it's about knowing where your body is at, because your health changes just like your life changes, right?
Yeah, absolutely. And it's not it's not stuck. You don't do one 715 health check and say, okay, I'm done for the rest of my life. It's about that periodic, regular health check, not when you're sick. Because usually when you're sick, your doctor wants to concentrate on that and fix that. This is when you're well. It's really a great opportunity to yarn about yourself, your family, your health, what's worrying you, and for your doctor to really give you the once over. I compare it sometimes. You take your car in. If you got a motor vehicle, you take it in at least once a year for a full service, a full checkup. Got to do a rego check. They're checking the wheels, checking the tires, checking the engine. Even when there's nothing wrong with your car, you're doing that to prevent some further problems developing with your car, and to make sure your car operates safely. In the same way, it's a full checkup for your body to make sure that everything's okay at the moment and prevent anything bad from happening.
Yeah, so really those things that are not front of mind, right? Like even when you've just said to me, think about your bowels, your breathing, your kidney, your memory, I'm like, "Oh, actually, I don't think about those things at all
You
because
don't. Yeah.
it's not something at all." Like I think, "Oh, my I sit at a computer all day and I'm typing and sometimes I feel some aches and pains in my or tension in my lower back or in my shoulders and it makes sense to me because that would be because I'm sitting down and I'm spending time writing. I wouldn't be thinking about, I don't know, how my ankle mobility is or the flexibility in, wherever in some part of, my wrist or my elbow, or maybe you know what I mean? Like you're not thinking about those things unless they're at the forefront of your mind and you are feeling some form of discomfort.
Yep, yep. And you're right. We're all busy, right? Whether we're caring for people or whether we're working or whether we're studying or other things. We probably have things going on that it's not top of mind and we don't actually stop and think about it. And in a 715 appointment, your doctor will ask you a lot of questions about your whole body, but it's really useful before you go to the appointment to actually stop and think, from head to toe, what have I noticed about my body? Is anything changing? Is anything actually worrying me? But I haven't, had the time to actually go to the doctor and think of it from head to toe systematically and write it down on a piece of paper. Because if you just think about it in your mind, I don't know if people are like me, you'll forget as soon as you walk in the doctor's door. So write it down. And if there's anything you're noticing, try and remember some dates. Has this been for a few weeks, a few months, or how long has this been going on for? Write it all down and take it with you when you're going to see your health worker.
That's a really helpful point, right? Is to make a little bit of a list of those things because I am like you, Krishan. I do not remember a lot of things. I can, maybe that's one of the things I need to talk about in my 715 is that I don't remember where I put my telephone or my keys. I don't remember where I put my
Yeah,
slippers.
it's a
So I
it's a
got to
good
go back
point.
and
Yeah.
check those things.
Now some of that's
But
quite
that's a
yeah, I was gonna say some of that's quite normal. It may not be as we age.
Dr. Google
Yeah, it
again.
may be quite normal. So don't worry about that too much. But yeah, you're right. I think try and remember and then write it all down before you're going, and make sure to tell your doctor, hey, I've got a list today. During my 715, doctor.
Yeah, and it is really important because you are right. It is a very comprehensive appointment. What I will say to community, in my experience of getting a 715 check, I have had them that with some doctors, and it takes up to 90 minutes, 2 hours, because it's been detailed, and the clinician that I'm working with is really, really thorough in the work that they've done. And in other circumstances, I have been in a 715 check at an AMS where it has taken 22 minutes. And that is simply inappropriate, right? Because the whole point of this annual health check is to look in detail and to ask you lots of questions about your health and your well-being and your wellness. So my just a heads up to mob out there, please be mindful that these appointments take time because your health is complex and there is a lot to take into consideration. And if people are hurting you in and hurting you out very quickly, you need to start saying no, 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 no. We're doing this properly, right? This is going to be a proper
Yeah.
healthcare assessment. Any thoughts about that, Krishan?
I was going to say, look, 22 minutes does sound a little bit short to me. That sounds like a normal doctor consultation, not a 715. But I think maybe a good way to prepare would be when you make that appointment to just ask, the receptionist or the bookings people, how long does this usually take? And probably I would estimate it's usually more than 45 minutes or more to really do an in-depth assessment. And so if they say that, then you know that you're going to be thoroughly checked out and you can write your list of, everything that's going on. And your doctor can explore that thoroughly and, take a full history that's asking you questions, examine you to see if there's anything they can find. Maybe do some what we call in-surgery tests, which could be getting you to pee in a cup, or some breathing tests into a little machine. And then you may need some referrals for some other tests at another date, or to see a specialist doctor as well. But take the time and make sure that the clinic you're going to, the health service is taking the time as well. This is really important.
So preparation really is key here. Preparation in terms of you making the appointment, knowing what to expect, but then also making a list of the things that you want to talk about to make sure that your clinician or your GP is informed about what's going on with you and your
Yeah.
body, right?
The better you prepare for the appointment, the more that you will get out of it, is what I'd say. Preparation is really key.
Yeah, that's what my personal trainer says to me as well. And then, yeah, I'm not really thrilled about that. The more you put in, the more you get out, Dixie. It's not working for me, if
So,
I'm to be honest.
look, may not be working for you with the personal training, but that's exactly for all aspects of healthcare. The more you put in as a patient or as a person, the more you'll get out of every healthcare consultation.
Yeah, and I guess it's also a really good opportunity to build your relationship with your GP as well, right? Or the regular doctor that you're going to be seeing. Because we spoke about this before in some of the experiences that I've had and some of the challenges that, what I want to see in terms of how I would like to see my patient and doctor relationship kind of look and feel like, and what my expectations are and some of the things that will not will be the barriers why I don't come back to see a doctor or access a healthcare service. So I think using that session as an opportunity to really connect with your doctor, your healthcare worker, is an opportunity where you're not feeling rushed to get in and out and just have it over and done with. So that annual kind of checking in and understanding and building a relationship is also an added benefit of doing a 715 check, right?
Yeah, absolutely. I mean, people often think when they're in a healthcare consultation that the doctor is, assessing them, but you need to be assessing your doctor as well. And that can be difficult in a short consultation when you're sick and you just want the test or the prescription. But a 715, you have actually more time to talk to the doctor and assess them as well and see, do I actually want to come back to this doctor or do I need to keep looking? So you're absolutely spot on.
Yeah, and I guess this is one of the things that doctors do also need to take into consideration, that point that you've just said. We're also testing you, right? So make sure that you turn up, you present your best version of yourself in these appointments that we
Absolutely.
have together, right?
And bring a smile, I think you said
Yeah.
before as well, to build that rapport.
Yes, turn that frown upside
But
down.
all doctors should be doing that.
Yes, they should be. Should be a fun time for everyone. Okay,
No,
cool. Well, 715s, we've had a yarn about that. Thank you very much for your time today, and we will see you on our next episode.
looking forward to it. Thanks, Dixie.